Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Mitomycin Injection, exploring the various aspects of mitomycin, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of mitomycin injection. Mitomycin is a chemotherapeutic agent used primarily in the treatment of various cancers. Its primary indications include bladder cancer, gastric cancer, pancreatic cancer, breast cancer, and colorectal cancer. Next, dosage of mitomycin injection. The dosage of mitomycin varies based on the type and stage of cancer being treated, as well as the specific treatment protocol. Let's discuss the general guidelines. For bladder cancer, the typical dose is 20 to 40 milligrams once a week or every other week for 6 to 8 doses. Maintenance doses may be administered every month. For gastric, pancreatic, breast, and colorectal cancer, the dose is 10 to 20 milligrams per m2 every 6 to 8 weeks, depending on the regimen. Adjustments are made based on patient response, tolerability, and blood counts. Next, mechanism of action of mitomycin injection. Mitomycin is an anti-tumor antibiotic that works primarily through its DNA cross-linking properties. Mitomycin gets activated inside the cell to form an alkylating agent that cross-links DNA at the N6 position of adenine. This cross-linking inhibits DNA synthesis and function. The cross-links prevent the separation of DNA strands, blocking replication and transcription processes, ultimately leading to cell death. It is more active in hypoxic tumor cells, making it particularly useful in certain solid tumors. Next, side effects of mitomycin injection. Common side effects of mitomycin include hematological effects like myelosuppression, leading to leukopenia, thrombocytopenia, and anemia. Pancytopenia in severe cases. Gastrointestinal effects like nausea and vomiting, mucositis, and diarrhea. Renal effects like kidney damage and low red blood cell count. Dermatological effects like alopecia, rash, and skin reactions at the injection site. And others effects are fatigue and weakness, pulmonary toxicity, including interstitial pneumonitis, cardiovascular complications in rare instances. Next, important advice for using mitomycin injection. Comprehensive blood counts and renal function tests are essential before starting treatment. Consider baseline pulmonary function tests for patients with pre-existing lung conditions. Administer intravenously by professionals experienced in chemotherapy. Intravesical administration should be done under aseptic conditions to prevent infections. Regular blood tests to monitor bone marrow function. Monitor renal function regularly, especially in patients with pre-existing renal conditions. Monitor for signs of hemolytic uremic syndrome. Handle with care as mitomycin is a cytotoxic agent. Use protective clothing and follow proper disposal protocols to avoid contamination. Use antiemetics prophylactically to manage nausea and vomiting. Ensure hydration and supportive care for gastrointestinal side effects. Immediate intervention is required for any signs of severe myelosuppression or HUS. Inform patients about potential side effects and symptoms that need immediate medical attention, such as unusual bruising, bleeding, or signs of infection. Encourage patients to maintain good oral hygiene to prevent mucositis. Advise patients to report any respiratory symptoms or changes in urinary output promptly. Mitomycin injection is a potent chemotherapeutic agent with specific indications for various cancers. Proper dosing, administration, and vigilant monitoring are crucial to maximize therapeutic effects while minimizing adverse outcomes. Comprehensive patient education and supportive care strategies play vital roles in managing side effects and ensuring patient safety. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using mitomycin injection. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.